Hi, and welcome to Pennsylvania Newsmakers, and thanks for watching. Well, you may not know it yet, but when you go to vote on May 15 in the primary this year, you may have one, possibly two votes that will determine your school tax bill. But first, a health care update after these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to Pennsylvania Newsmakers, and again, thanks for watching. Well, a couple of weeks ago, we had Governor Rendell on. He's asked to come back. We're going to have him to come back in May, and he's going to chat with us about his health care proposal, this very ambitious idea to cover about 900,000 Pennsylvanians who don't have any health care. We've been doing these health care updates. They're very, very important because of the vast changes that are taking place in the health care field. Joining me today, as often is the case, is Jim Redmond. He's the Senior Vice President from the Hospital and Health System Association, and Brian Kelly. He's the Director of Government Affairs at the Pennsylvania Chamber of Commerce, Business, and Industry. You know, all your little chambers, the county chambers, I shouldn't say little, have a kind of little derivations of that. Do I got that right, Brian? All right, Jim, look. We've been trying to figure out where Governor Rendell is going to go. I think everybody admits that the broad goal of what Governor Rendell is trying to do is laudable. Both you guys admit that, right?
Absolutely.
Yes. The arguments are over, as you might expect, the details, and particularly who pays for it. Tell us where, give us an update. Where does the governor's proposal stand now?
Sure. Really are two parts to it. First of all, much of his proposal has been introduced into the legislature in House Bill 700. The legislature has been conducting lots of hearings around the state, learning about the details. The second part is that he proposes to issue some orders by executive order on a number of things. So, but much of the body of the proposal is in House Bill 700.
Now, does this concern mostly the business about covering the 800,000 or 900,000 folks? We don't know. Doesn't matter how many. Let's say 900,000 just for the sake of our conversation. Does it mostly concern that, or the governor talked about all sorts of things, patient safety stuff. He talked about, you know, the scope of practice. Does it concern all of those things, or just the core proposal about the 900,000?
No, it includes more than just dealing with the uninsured.
Okay.
It deals with patient safety, deals with health information technology, deals with scope of practice of nurse practitioners and physician assistants. So there's a lot in this particular bill. It's over 90 pages.
90 pages, one bill. All right, Brian, let's go to you. Now, I think the most controversial aspect of this, by any stretch, has to do with how it gets paid for. I mean, everybody wants this. And what does the governor propose how this gets paid?
Well, I mean, the primary focus, you know, for the business community with regard to the governor's proposal and how it's going to be paid for relates to the Cover All Pennsylvanians uninsured health program for all uninsured adults in the state. The primary way he's going to pay for that portion of the plan is a payroll tax, which is a payroll tax of 3% on all employers in the Commonwealth. So, you know, as you can imagine, with, you know, businesses of all sizes, shapes and those types of things, you know, they're already struggling with rising health care costs, double-digit premium increases. So, you know, levying a 3% payroll tax on the employer community is going to be pretty difficult.
Now, does that include all employers?
That's
whether
correct.
You pay?
Yes.
So, in other words, if you're paying $8,000 or $10,000 per person per year, which I don't think is out of the, is that a bad number? 8, 10, 12,000?
No,
I mean,
that's about right.
That's fairly accurate.
Whatever it is, you know, depending on the situation, the governor's saying you got to pay more, even, or you got to make this 3%.
What the governor is saying is that all employers, those that provide health insurance as well as those that do not, will have to pay 3% of their total payroll to help fund this program.
I guess my question is, what incentive, is there incentive for, if you have to pay it, then why would you continue to provide the coverage? Let's say that I'm a struggling small, we get a lot of small business folks on the program here, you know, talking about what they do and how they do it. But let's say that I'm just sort of a struggling, you know, just making a little profit. I have maybe 40 or 50 employees. I'm doing okay. I'm paying, let's say, $8,000. Why wouldn't, and that could be 8 or 10 or 15% of my payroll. Why wouldn't I drop the coverage and just say go to 3%?
That is a great question, and that is a concern that we have, that most businesses from a financial standpoint, looking at their bottom line, are going to see that 3% as much, much more advantageous than the current, 15, 20, or 25%, per year that they're paying. The concern then becomes you're adding those people then into a state program and increasing the number of uninsured, because if an employer decides to opt into that Coverall Pennsylvania program and pay that 3%, as opposed to what they're currently paying, there's no guarantee that their employees of that employer will automatically get health insurance.
Now,
go ahead.
I might add, Terry, that under the governor's plan, if you do have a qualified health plan, which is not described in the legislation, then you do get a 3% credit. So
is
the
that
idea,
a credit on your state tax? Is that how that would work?
Well, the 3% payroll tax that Brian mentioned, what the governor is really trying to get at are those employers who do not provide coverage would only pay that 3%.
Okay.
Now, one of the great concerns that we all have is that there's a recent court decision that challenged a Maryland law that was very similar to this law, and this law may have some problems in terms of its
same legal situation.
Same legal situation that it may be in violation of federal law.
All right, we're doing a health care update. This is important stuff. This is the governor, I think of all the governor's programs that he's proposed, some 5 big ones, maybe the most ambitious of all of them. We'll continue with this discussion when we return.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is presented by Pennsylvania Medical Society. Doctors and patients, preserve the relationship. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program. I'm chatting with Brian Keller from the Pennsylvania Chamber and Jim Redmond from the Hospital Association. We're talking about the governor's very ambitious health care program. All right, let's go to another dimension of this. Another dimension of this, gentlemen, is this, are what we call the cost drivers. Now, as you know, there are a lot of sort of cost drivers in the current system, but every new program, particularly this kind of sweeping program, has cost drivers in it. Jim, let me start with you. Identify what you think needs to be done first as we, before we even get into implementing a program for 900,000, cover 900,000 Pennsylvanians. Are there costs that we ought to be, getting out of the system now or lowering?
Sure. Let me talk about 2, Terry. One, and this is where I think the governor is correct. We have the opportunity to really make our healthcare system more efficient and even safer by advancing the use of health information technology. Technology is now available to have electronic medical records, computer order entry systems, electronic prescribing. All of those kinds of systems are now available. They obviously cost money. Pennsylvania hospitals actually are further ahead than other states in this area, but that, I believe, is a fundamental building block to the development of a more efficient and safer healthcare system. The second is that there are a series of unfunded mandates on hospitals in House Bill 700, the governor's proposal. The most significant one on hospitals is that they're changing the community benefit for nonprofit hospitals and changing sort of what you can use to calculate the amount of uncompensated care that is provided in hospitals. And that definition change we calculate to be almost $1 billion on hospitals.
Brian, you're concerned about the way this could drive up costs, or not reduce costs.
One of the ways that we have suggested to legislators once this plan was rolled out is there's a number of other cost drivers that aren't identified in the governor's plan as was introduced in the last couple of weeks. One of those is the issue of lawsuit abuse reform, the need for joint and several liability, not just for the medical community, which is greatly needed, but for a broad-based effort on joint and several liability. Protection for innocent sellers, including medical devices, caps on non-economic damages. So there is a need for additional tort reform. The other issue for us is, the governor's plan includes two very costly health insurance mandates under the Coverall Pennsylvania program, that being the need for prescription drugs and behavioral health. At a time when we already have 31 or so existing health insurance mandates in the state, one of the things the business community would like to see is before we add any new health insurance mandates that collectively add tremendous cost to our healthcare system, let's take a cost-benefit analysis of those and see where we stand.
Okay. Let's go back to sort of the basics, and you can help me out here. Jim, you and I have chatted about this over the years. Folks are going to get health care coverage somewhere. It may be that they're not doing anything about preventative care because they don't see a physician, they're not getting the right kind of treatment because they're not going to see anyone, so they pop into an emergency room in one of your hospitals when there's a problem. Is there anything that is in this program that, and I know the governor has talked about this a bit, that will help us do more for sort of the long-term preventative care considerations that would overall reduce health care costs? So instead of going into some situation when they've let a condition go for 2 years or a year, and now we're talking about it's aggravated, it's serious, and so they go into one of your hospitals. Anything in the governor's program, he talks a lot about preventative care.
There are two things that I think are key. One is that he has suggested, although it's not included in House Bill 700, that hospitals have urgent care centers next to hospitals. Now, our studies show that over half of the hospitals in this Commonwealth already have that. Those that don't, generally, there are two reasons. One, they don't have the volume, like a number of rural hospitals, or they don't have the physical space to accommodate that. The second is that the proposal talks much about the need for improvements in chronic care conditions, asthma, diabetes. Those are going to require a lot of cooperation, not only on the part of better coordination on the part of healthcare providers, but also the patient. The patient has a lot to do in terms of how they take care of themselves, how they test themselves, how they take their medications.
So in other words, that's another sort of hidden cost driver that if they're not doing this by the time a chronic condition gets to be acute or there's some emergency that gets created because they're not doing, folks aren't taking greater responsibility over their health care. Is that your point?
Sure. I mean, there are numerous studies that show that there are preventable hospital admissions. The problem for us is that if these patients show up in our emergency departments, we have to treat them.
Of course you do. All right, gentlemen, I want to thank you. Great update. All right, when we come back, you may not be aware of it, but there's going to be some measures on the ballot in the May primary that deal with school taxes. You better get on to this and pay attention, and we're going to bring it to you next when we return after these messages.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Credit Union Association, Pennsylvania Credit Unions, where people are worth more than money, and by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education, 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Joining me to discuss this complicated property tax reform shift, whether you get the vote on this stuff or not, is Tim Allwein. He's the Assistant Executive Director of Government Member Relations for the Pennsylvania School Boards Association, and Ron Cowell. He's the President of the Education Policy and Leadership Center. Full disclosure, I'm on Ron Cowell's board, so I want to get that up so everybody is aware of that. All right, Tim, I want to start with you. There's certainly going to be one question on the ballot in most school districts. We'll talk about that in the next segment that has to do with a switch. Property tax down, you pay earned income tax or personal income tax up. But I don't want to talk about that now. I want to talk about something else that was part of this education package passed was it last year?
Right.
Last year, that deals with whether or not property taxes can go above an inflation index. Explain that as quickly and as simply as you can.
Well, that question is known as the back-end referendum question. And what the Act 1 said is that if a district raises taxes above a certain inflationary index, that they have to take that question to the voters. However, the law did provide for 10 exceptions to that rule. And we had 210 school districts that sought and got an exception from the Department of Education. Out of 501, correct. And so those districts will not have to go to back-end referendum. The other districts are limiting their tax increases to the index. So I would say that in approximately 290 or so school districts, Act 1 is working because it's keeping district tax increases at or below their index.
Well, hold on. I got that, but isn't the... Ron Cowell, because they're below the inflationary index doesn't necessarily mean that there's sufficient money to run the schools, does it?
No, it does not. I think first dealing with the issue of whether or not they're going to referenda and whether they stay below or need to go beyond the index. I think from a taxpayer standpoint, there's largely news here that says school districts are acting pretty responsibly. Keep in mind,
so many.
Well, keep in mind some of the impetus for Act 1 was to create taxpayer rights and to get a control on what some legislators characterized as excessive spending on the part of school districts. We've got a situation now, as this law is being implemented, where a couple hundred school districts have applied to the state and said the exemptions that are provided for under state law are causing them or may cause them to have to go beyond the index. Right. And the State Department of Education has said, you're right. And those exceptions are largely cost drivers that result from state law, state mandates. Pensions, for instance. Health care, special education. So you got a couple hundred districts that are in that position. You have more than a couple hundred districts that are in a position of saying, we don't need exceptions or exemptions.
Because they're below
We're going to stay below the index. Yeah. So right now it appears that only a handful of school districts will have to put the question on the ball. That's largely good news for taxpayers who are concerned about whether school districts are spending in an out-of-control way.
So the school districts in the state, then, essentially your argument would be are acting mostly responsibly on this matter.
Correct.
But what is the fundamental problem? I mean, do we have any of the revenues to reduce property tax yet from the gaming?
We don't. It's projected that those revenues will be available possibly beginning next year. But we're a lot closer to that, of course, than we were a year ago.
But no money yet on the no money yet into the school district's coffers.
That's correct. That's correct. And as you know, the property tax relief is going to be financed in two ways. Number one, by the revenue from this income tax, if voters approve it, and number two, with gaming dollars. Right. So if a district's voters do not approve the tax switch, which we'll talk about a little later, and there's no gaming money, then there won't be any tax relief until possibly next year.
I want to get, before we leave this program, I want to get into this business about whether all this makes sense or not. I mean, you know, we've had, I'm going where I didn't want to go, but look, a lot of people said, we're talking about $9 or $10 billion. Can we all agree $9 or $10 billion property taxes for schools? Somewhere in that.
Right.
This doesn't deal with it. And it doesn't deal appropriately with the problem, which is a state problem first, a school district problem second, and there's only two sources of income that can possibly deal with this: the income tax or the sales tax. Ron, am I right or am I wrong about that?
You're right. The problem is that over the last several years now, the governor and the legislature have spent an enormous amount of time and energy and some legislative action dealing with the symptoms of an underlying problem. The underlying problem is we have one of the worst statewide school funding systems in the country. And it is one of the worst because the share of K-12 costs paid for by state government in Pennsylvania are only 35%, far below the national average. All
right, when we come back, we're going to continue this discussion. We're going to get into this referendum that many of us are going to have to deal with in May when we return.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Builders Association, building today for a better tomorrow. And by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back. We're talking about the school referendum. I guess most school districts will have one, this so-called switch.
Right.
Tim, explain this as succinctly as you can.
Sure. It's a tax shift. That's just what we call the front-end referendum. And what the question will ask voters is if they want to take some of the funding burden for school districts off of the local property tax and shift it to a local income tax, either an earned income tax or a personal income tax.
Now, is this going to occur in all but 3 school districts in the Commonwealth?
That's correct. Every school district except Philadelphia, Pittsburgh, and Scranton. The voters will have an opportunity to vote on that question.
All right. Now, Ron, the school boards are required under law to present a question on this switch to the voters. Is that correct?
Yes.
Talk a little bit about that.
Well, there was a requirement for a tax commission, first of all, to develop recommendations for the board. Then each board puts a question on the ballot, and the voters have an opportunity to say yes or no to a switch. The switch can be significant. It can be relatively insignificant. It can be from property tax in part to income tax or to earned wage tax or earned income tax. So there are a host of variations on this around the state. The point that I would like to emphasize is that for 30 years, folks have believed that school boards ought to have more discretionary authority, to have a different kind of mix.
Right.
That should not take away from the discussion, though, about the underlying problem.
Right.
And that is the state's failure to sufficiently fund public education in this state with state dollars. As a result, there's more of a burden on local taxpayers.
Okay, we have about 20 seconds. Are you basically in agreement with that?
Yes.
So what you guys want is a secure state source that relieves the local property tax and all these other mix of taxes, and that's the responsibility of state government. You both of you, I think, agree with that, right?
Yes. Yes.
All right, look, we're going to continue with this discussion. We're out of time now, but this is a great discussion. We hope you've gotten something out of it. On May 15th, you're going to have to deal with that. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and stay well.